Hi, this is Herb Chase, and this is a little review of how to interpret test results. I'm sure you've heard this all before in your prior courses. We'll just have a quick review, and then you can move on to the problem set. The learning objectives today are quite straightforward. At the end of this talk, you and your problem set, you'll be able to explain how the results of a test for a condition change the probability that a patient has that condition. A patient has a positive test. Does that mean they have the disease? They have a negative test. Does that mean they don't have the disease? And you'll also be able to define terms that I'm sure you've heard before: sensitivity and specificity, pre and post test probabilities, positive and negative predictive values, and positive and negative likelihood ratios. And lastly, we're going to use a website to calculate the probability that a patient does or does not have the condition based on the results of a test. There are phone calculators, which I have yet to find a good one. If you find one, please let me know. But we'll use a web-based calculator. Let's start with the case. Imagine you are in a call center, HIV call center, and a person calls and asks, what is the probability that I am infected with HIV? Assume you know nothing about the person. You don't know their age, their gender, their lifestyle. And the probability of HIV would be the prevalence. What's the total number of HIV cases in a cohort, such as the United States, as a percent of the total number of persons in that cohort? So in the US, we have 300 million people, and roughly 1.2 million people are infected with HIV. So if you just calculate the probability here, the probability that this caller, who you know nothing about, is 0.4%. That's 1.2 million divided by 300 million. The same caller calls back and says, I had an HIV test and it's positive. Again, you know nothing about the patient other than, or the caller, except that he or she had an HIV positive test. The pre-test probability, that is before you got the results of the test, was, as we just calculated, 0.4%. And now we're asking, what is the post-test probability? What is the probability after having this test, which in this case has been positive? And we also like to phrase it as, what is the positive predictive value of the test? What is the probability that a positive test in this patient has HIV? So if we want to calculate the positive predictive value, or the post-test probability, we need sensitivity and specificity. Here's our definition of positive predictive value, and it's obviously true positives divided by the total number of positives, both true positives and false positives. If this were a perfect test and there were no false positives, then the positive predictive value of a positive test would be 100%. But sadly, most tests are not without false positives, and so we need to know what that false positive rate is. And these values are obtained by looking at the sensitivity and the specificity. Sensitivity, just to remind you, is the proportion of patients with the condition who have a positive test. These are true positives. Test is positive and the patient has the condition. But there will also be patients with the condition who don't have a positive test, and we call them false negatives. That is falsely negative because they have the condition. Specificity looks at patients without the condition and asks what percent of patients without the condition have a negative test. These are true negatives. And it also looks at the proportion of patients without the condition who test positive. These are false positives. And these definitions are repeated up here. So we look at what do we need for positive predictive value. We need true positives and false positives, and we're going to get that by looking at the sensitivity and the specificity. Now let's take another look, a sort of a schematic look at positive predictive value, and it gives us a little idea of magnitude. We have 300 million people, and the prevalence tells us that 0.4% of those 3 million people actually have HIV. That's 1.2 million people. On the other hand, 298.8 million people don't have HIV. So we get these numbers by looking at the prevalence. Now we ask, of these 1.2 million people with HIV, how many of them end up having a positive test? Well, we looked at our sensitivity which is 95%, which means 95% of 1.2 million people have a true positive result. These people have the disease and a positive test. But there's 5% of patients who will have a negative test, even though they have HIV. These are the false negatives. And in this case, we have about 60,000 people. So there's 60,000 people potentially in the United States who will have a test for HIV, a rather mediocre test, even though these numbers look good, and they will actually be HIV infected and have a negative test. So we've got our true positive rate here. Now let's look at our false positive rate. Well, we have almost 300 million people without HIV, and the specificity tells us that 95% of them will have a negative test, appropriately negative. That's a true negative. So 283 million people have a negative test, but there's going to be 5% of these people who have a positive test, even though they don't have HIV. So we have a false positive rate, which is substantially greater than the true positive rate. It means if we tested every person in the United States for HIV, we'd see that there are way more, 15 times more false positives than true positives. But now we have the numbers we need to calculate the positive predictive value. What's the probability the patient has HIV following the positive test? So here's our formula, true positives over true positives, false negatives. We plug in the numbers that we just got, and we have 7.1%. The positive test changed the probability of HIV in this caller from 0.4% to 7.1%. What did you need to calculate the positive predictive value? Yes, of course, you need the pretest probability. In this case, it's the prevalence, but we'll see in a second when we apply a second test, the pretest probability will not be the prevalence. But in this case, the pretest probability was prevalence. We needed sensitivity and specificity, and we could also use likelihood ratios. These are very convenient, and as we'll see in a second, the websites that enable you to calculate the post-test probability prefer likelihood ratios, which combine sensitivity and specificity. The likelihood ratio is, for a positive test, is sensitivity divided by 1 minus specificity. And what is this really measuring? Its sensitivity is the true positive, how many people with the disease have a positive test, and 1 minus specificity is the false positive. Specificity gives us the percent of true negatives, but then we have a 5% chance, as we just saw, of a false positive. So the likelihood ratio is the more commonly used variable to calculate the post-test probability. Let's look at the web-based calculator, which I just showed you. Actually, let's just go back and hit this for 1 second just to show you where this is. This is UCSF. It's got a beautiful calculator. It's got a pretest probability entry, and you plug that in. It's got a likelihood ratio, which you plug in, and then you can calculate what the post-test probability is. So let's go back to this and say we're going to put in the pretest probability, the likelihood ratio. What do we get? Well, for a positive test in this patient, we start out with a pretest probability, the prevalence of 0.4%, and the likelihood ratio for this test, sensitivity divided by 1 minus specificity, is 19, 95 divided by 5. And we plug in 19, hit the calculate button, and we see that the post-test probability, the probability that this patient has HIV, is 7%. Now that's not very high, 7%, although it's considerably higher than the 0.4% that the patient, or the caller, started out with. But 0.7% is still pretty low, but we may not be satisfied with it, so we're going to have to think about what we're going to do next. But in the meantime, let's just ask, well, what would be the probability that this patient had HIV if the test had been negative? So we do we go through the same drill. We put in the 0.4% pretest probability. Here, the likelihood ratio, the negative likelihood ratio, is 1 minus sensitivity. That's the false negative rate. And we divide it by specificity, which is the true negative rate. That comes out to 0.53. We plug 0.53 and we do the calculation, and we see that the chances of that caller of having HIV with a negative test, despite how the test is not perfect, is close to zero. It means that there's very little chance they actually have HIV. As we just discussed, the caller with the positive test has a 7% chance of having HIV. Although that number is small, it needs to be worked up because 7% chance of having HIV is a significant risk for a patient. So the strategy is to go from a relatively not mediocre test, but a poorer test to a higher sensitivity test. Often this is because the screening test is cheaper than the second, more specific test. And let's ask, what are the post-test probabilities of a patient if we use a second test with a much higher sensitivity and specificity, 98% specificity and sensitivity? We calculate the likelihood ratios of 49 for a positive test and 0.02 for a negative test. And now the pretest probability is not the prevalence, obviously. It's 7% because that's based on the prior test. And we ask, what are the post-test probabilities? We use the calculator that I've just shown you, and we get the following output. We start out with 0.7%, 7% pretest probabilities. If the test is positive, the likelihood ratio we plug in is 49. We calculate, and we get a post-test probability of over 50%. That if that second test is positive in this caller, then the patient is going to have a greater than 50% chance of HIV. On the other hand, if the test is negative and we plug in the negative likelihood ratios, we see that the post-test probability is 0.2%. That's even lower than the prevalence, making it very unlikely that the patient has HIV. And that second test really would reassure that patient. Well, you had a positive first test. It wasn't the best test that we have, but it was the cheapest one. And now we have a more expensive but a much more accurate test, and it was negative, and you have a less than 1% chance of HIV. So the strategy of a less accurate test to screen patients and then a more accurate test to rule patients out is one that we commonly use and have a series of tests that we go through to refine the post-test probabilities. So what did we learn today, or what did we review? I'm sure you've heard this all before. We reminded ourselves of what pretest probability is, the probability of a condition before the test has been performed. We reminded ourselves of the post-test probability, the probability of a condition after we've performed the test. We also reminded ourselves that sensitivity and specificity or likelihood ratios are needed to calculate the post-test probabilities. So you need three things. You need the pretest probability, and you need the sensitivity and specificity or likelihood ratios. And then with those, we could predict the value of the post-test probability and figure out whether or not the patient has the condition that we're looking for. And lastly, remind ourselves of what the predictive value of a screening test is. We have positive predictive value, the probability that a subject with a positive test has the disease, and the reverse for negative predictive value. Thank you, and I hope this quick review was helpful.